I'm interviewing Linda, and my question is, do you think that health insurance should be an option and open enrollment whenever deemed needed?
I think that open enrollment should be whenever you need it. That's just my opinion. The reason being is because they have so many, those packets have so many things, the benefits, what they cover, what they don't cover, and you don't have enough time to actually go over everything in the short period that they give you. And it's funny how open enrollment, it has a certain day and it has 3 months period before you can actually enroll, but you also find out at the last minute. So it's like you're feeling pressured to hurry up and sign this paper, and then you don't even know what the doctor is covering. So I don't think that they should actually put a time frame on whether or not you should enroll on this date or not. I think that it should be open, and you should do it whenever you need it.
Thank you. And my question for you is, do you feel that a healthcare service that is medically necessary should be determined by a doctor or your insurance company?
I think in a perfect world, it should be determined by your doctor or your healthcare provider because they're actually the ones who know what your conditions are and if this is a procedure that's going to benefit you. Now, in the non-perfect world which we live in now, it's unfortunately determined by the insurance company. And that's because the insurance company, at the end of the day, is looking at their bottom line. It's about money for them. I understand that they need to save on costs, but them saving costs is also affecting the customer's, health because the person that's making these decisions is not medically trained. They have no formal training in anything but just denying or accepting claims based on a criteria that is laid out by someone else who's looking for money. So at the end of the day, for me, these are decisions that should be made by your healthcare provider and by yourself, not by their insurance company who's only looking out for their bottom line.
Thank you.
You're welcome.
My question is, do you think the government should provide insurance to everyone or just the working class?
I think the government should supply insurance to everyone and not just the working class because eventually somebody is going to have to pay for it anyway.
And how does that play in your job?
With my job, a lot of people who don't have income or have low income are going to the emergency rooms and don't have insurance. So eventually somebody's going to wind up paying for it. So
Who do you think is paying for it?
the upper class, the rich people, people who pay taxes.
Do you believe that insurance should be an option?
No, I think everybody needs insurance
Why?
because healthcare is so expensive. So everybody needs insurance.
What if you can't afford insurance?
If you can't afford insurance, then I think that it should be like the welfare system. They give you insurance for a certain amount of years, put you in a program where you can be empowered to be on your own. And just like the welfare system, they give you 5 years to get a job and get out on your own, and they support you until the 5 years is up. But they put you in a program so you can be able to help yourself.
Thank you.
You're welcome.
Well, this class has been very interesting. I've learned a lot. Healthcare will always be an issue for the United States. Um, Whether it's Medicare, Medicaid, HMOs, private insurance, self-pay, there will always be a dilemma in the United States. Everybody has their views. Everybody has their opinion. But it's only one opinion that's going to count, and it's the government. We go hear them all. They all make sense to a certain degree. But we all have to come to agreement sooner or later, and no one's going to ever be pleased. This country would never be right with health care. Obama's going to be president for Obamacare, trying to make it right. The next president is going to try to do the same, and on and on and on it's going to go. So it's been a dilemma forever, and it's going to be not with this president, but with the next one, the next one, and the next one. So there's my view about the whole health care insurance and all the dilemmas. I thank you for this class, and good luck to everybody in your next endeavors. Okay, do you think dogs should have insurance?
Yes, dogs should have insurance because we need to eat and we don't have opposable thumbs, so we can't do it ourselves.
And how do you expect to pay for it?
My mommy and my daddy.
Thank you.
Bye.